Hi, I'm Dr. Jing Liang. I'm a medical doctor and I specialize in pain and inflammation. I like to look at the root causes, why people are having the symptoms, and taking a whole body medicine approach to help them heal. Before we start, I want to share why this topic is personally important to me. Several years ago, I noticed a gradual decline in my own health. I wasn't recovering from the exercises the way I used to. My energy was different. My mood was different. Things had always helped me stay resilient, just wasn't working out anymore. Then I developed this really significant skin condition that became progressively worse. I saw dermatologists and tried different treatments, but no one could really explain why it was happening. And at the same time, my liver enzyme were very abnormal. Eventually, from one thing led to another, I discovered that the roof of our home had been slowly leaking for years. There was moisture and mold hidden behind multiple walls in multiple rooms. We had some of the challenges that many Midwestern homes face. The basement had humidity. There was also inadequate airflow to the house from the roof, and many other factors that can create the perfect environment for mold growth. The damage was significant enough that my family and I ended up living outside our home for about 3 months while remediation was being completed. What struck me was that the mold wasn't only a house issue, it became a long term health problem. And it wasn't one single event, it was the accumulation of multiple factors over time: the environment, the home design, moisture ventilation, and ultimately how my body was responding to those exposures. As I started learning more, I began to see similar patterns in many of my patients. There are people who are doing the right things, eating right, exercising, taking supplements as needed, and also listening to their doctors to follow their treatment plans. But their recovery wasn't progressing the way I would expect. That experience is what led me to develop this webinar. My passion has always been helping people understand the deeper factors contributing to chronic symptoms and helping the body build resilience. Because life will always present challenges, whether they're physical, environmental, emotional, or health related. The goal isn't simply to eliminate every stressor or chase symptoms from one treatment to another. The goal is to create a body that can adapt, recover, and heal more efficiently. Today, we'll talk about mold exposure, how it can affect health, and how to recognize it may become part of the picture, and lastly, practical next steps for recovery. Mold is not the answer for everyone, but for some people, it is the missing piece. So, a quick disclaimer before we begin. This presentation is for educational purposes only and is not intended to provide personal medical advice. Any decision regarding testing or treatment should be made with your own healthcare provider based on your individual circumstances. Before we talk about how mold affect the body, it's important to understand why this topic has become such a major focus in the functional and environmental medicine. The reality is that water damage is really common. Most people think of major flooding events, but mold doesn't require a hurricane or a flooded basement to become a problem. Some things as simple as a small roof leak, a plumbing issue, condensation behind a wall, poor ventilation, or elevated humidity can create enough moisture for mold growth. In fact, mold can begin to grow within 24 to 48 hours after water intrusion if the conditions are right. What's also important is to understand is the exposure doesn't only happen in your current home. It can occur at work, at school, at a previous apartment, college dorm, or a building where you spent a lot of time in the past. One of the reasons mode is often overlooked is because people assume they know if it were present. They would think that they're able to see it or smell it. Sometimes it's not true, but a lot of times the source is hidden behind drywall, underneath the flooring, inside crawl space, attic, or even within the HVAC system where it's not obvious. The second challenge is that symptoms usually don't appear overnight. They develop gradually over months or years. People may notice they're more fatigued than they used to be. Recovery is going to take longer. Sleep is not restorative. Concentration is harder. Worsening allergies. They develop new sensitivities or symptoms that don't fit neatly into one diagnosis. Because the changes are gradual, they're often attributing it to stress, aging, hormone changes, a busy lifestyle, or just simply getting older. And sometimes those factors absolutely play a role, but one of the questions we want to ask is whether there may also be environmental factors contributing to the bigger picture. The challenges isn't whether Mo exists, it's recognizing it when it may become affecting your health. Let's talk about what actually happens inside the body when mold exposure become part of the equation. When people think about mold, they think about allergies. They think about sneezing, congestion, itching eyes, asthma, chronic sinus issues. And those certainly are possible um, because of mold exposure. But what makes mold particularly challenging is that it doesn't always stay confined to the respiratory system. I see clinically that mold can affect multiple systems throughout the body. For some people, it primarily triggers the immune system. But for other people, it could contribute to ongoing inflammation and pain. It appears to activate the nervous system and keep the body in a persistent state of stress or threat detection. When that happens, the symptoms can start showing up in ways that don't immediately seem connected. A person can notice increasing fatigue. They can feel mentally foggy or having trouble concentrating. Their sleep becomes lighter and less restorative. They even have headaches, increasing sensitivity to foods or chemicals, worsening allergies, skin issues in my case, or a greater tendency towards histamine related symptoms. Some people also describe the feeling like their resilience has changed. What I mean by that is that they don't bounce back the way they used to. Exercise takes longer to recover from. Illnesses linger. Stress feels harder to handle. Their body simply seems less adaptive than before. One way to think about this is that mold exposure can act as additional stressor on the body. If someone is already dealing with other stressors like they have poor sleep, chronic illness, hormonal changes, nutrient deficiencies, emotional stress, it could be enough to push the system beyond the ability to compensate. And this is one reason why people can live in the same environment but have very different experiences. One person can have very little symptoms, while another person has significant health concerns. It's important to emphasize that none of these symptoms automatically mean mold is the cause. Fatigue, brain fog, sleep problems, and inflammation can have many different explanations. But when you have multiple symptoms begin to occur together, especially in the setting of known water damage or mold exposure, it's worthy to start investigating. So the next question is, if mold can affect the body in so many different ways, what symptoms should raise your suspicion that mold may be part of the picture? When I'm looking at somebody, a patient, I usually not looking at one specific symptom. A patient can come in with one symptom, but I'm looking at patterns. Because almost every symptom on the slide can be caused by many different things. Fatigue can come from poor sleep. Brain fog can come from stress. Joint pain can come from inflammation, aging, or overuse, or poor body mechanics. But what usually catch my attention is when multiple symptoms are appearing across different body systems at the same time. One common pattern involves the brain. Patients tell me they have problem concentrating. They walk into a room and forget why they went there in the first place. They lose words during the conversations. They can feel mentally slower than they used to be. And another common pattern is fatigue. And it's just not feeling tired, but feeling like they're never truly recharged. They sleep, but they don't wake up refreshed. Exercise recovery takes longer. Everyday activities seem to require more effort than they used to be. And I also see immune related symptoms. Patients have chronic sinus congestions, seasonal allergies that seem worse than before, histamine problems, skin problems, and increasing sensitivity to certain foods. Some people even develop what resembles mast cell activation syndrome, where the immune system seems to react more strongly than expected to everyday normal exposures. Another pattern would involve the nervous system. Some people can feel wired but tired. They're exhausted, but they can't really relax. They can't tolerate stress. The smaller, even small conversations would make them very reactive. And they have difficulty calming their minds because they're always ruminating about something. And their sleep becomes lighter, fragmented, and less restorative. So again, none of these symptoms can prove mold is the cause. But when I see symptoms involving the brain, energy system, immune system, and the nervous system all occurring together, especially with a history of water damage or exposure, that's when mold becomes something worthy to be investigating. So, why do people seem to be more affected than others when they have mold exposure? If two people live in the same house, why might one person become more symptomatic while another has very few symptoms at all? Let's talk about individual susceptibility and total body burden. I would think this is the most important concept we'll be discussing today. Many people become confused because they know someone they live with in the same environment, don't have any symptoms. Maybe it's a spouse or a child, maybe even a coworker, and they're wondering if mold was really the issue, why shouldn't everybody be sick? Two people can be exposed to the same environment and have very different responses. The reason is health is influenced by both exposure and susceptibility. Exposure is the environment piece, but was there, so the question would be, would there water damage, mold growth, poor air quality, ongoing moisture problems? But susceptibility is the body's ability to respond to that exposure. Genetics definitely will play a role. Your immune function may play a role. Is somebody undergoing hormonal changes? What about previous toxin exposures? And everybody's nutritional status may be different. This is what I call a total body burden. Most people aren't dealing with just one thing. They may be balancing work, stress, sleep issues, maybe previous infections. At some point, the accumulation load of stressors become more than the body can compensate for. That's why I don't focus only on whether mold is present. I like to focus on how a particular person is responding to their environment. Because the question is not, is there mold? The more important question would be, how is this person's body handling the exposure? So if someone suspects mold may be contributing to the symptoms, the next question should be, how do we actually investigate it? So let's talk about different ways we can assess both the environment and the person. The reality is that I don't suspect mold based on one symptoms alone, as mentioned before. I look at patterns. One of the first thing I ask is timing. The symptoms begin after moving into a new home, after renovation. What about a flooding event? What about discovering a water leak or spending time in a damp basement environment? Sometimes patients will tell me they felt completely different after a particular move or building exposure. And that would get my attention immediately. The second thing is the symptom pattern. It is a combination of fatigue, brain fog, and poor sleep. That also gets my attention, especially if they have sinus issues and increasing sensitivity to food and chemicals, or they have histamine related symptoms. The next clue is that when somebody has multiple practitioners, complete extensive testing, and still don't have a clear explanation why they feel the way they do, then I would start asking questions about their environment. We're looking at patterns across multiple body systems. So when I see symptoms that's involving the brain, immune system, nervous system, how the energy is being produced, why are they inflamed, I become more curious about whether something in the environment may be a contributor. But once again, Mo is not automatically an answer, but it is becoming one of the factors I should consider. So once Mo becomes a possibility, the next question would be, how do we test for it? And that's where things can become a little bit more complicated. So patients come into my office and hoping that there's one perfect test that can definitely answer the question. But unfortunately, mold isn't usually that straightforward. There are tests that evaluate the environment. These are the tests that look for evidence of water damaged buildings. There are tests that measures mycotoxins, these little particles that's emitted by the mold organisms. There are laboratories that can test for markers that suggest inflammation and immune activation. There are also screening tools like visual contrast, sensory testing that can provide additional information, which I use quite often with my patients. But the challenge is that every test has its strengths and limitations. A positive test does not always mean someone is sick, and a negative test doesn't always mean that the mold is contributing. That's why I try not to focus on one single test. Instead of, I think testing as one piece of a much larger puzzle. We should look at the environment. We should look at the symptoms and, really importantly, the timeline. That's why talking to patients is so important. And then I use the testing to add additional information. When the pieces begin to tell me the same story, we can be more confident that this may be a mold related issue. There is no perfect test, but our goal is really to understand the bigger picture. So if you have identified mold as a contributor to your health issues, what can we actually do about it? So the first step may or may not be a surprise to you, but it's usually not supplements. It's going to be addressing the environment itself. When people discover mold may be a contributing factor in their symptoms, they really have a temptation to just jump straight to treatments, detoxification protocols, getting binders, very a complex recovery plan. But recovery usually requires two separate steps. The first is super important, reducing exposure. If there's ongoing source of water damage, mold growth, poor indoor air quality, that has to be addressed. It's non-negotiable. And it is a big to-do. I understand. I've been there. Because if we don't address it, we're asking the body to heal while it is still being exposed to the same stressor. One thing I learned through my own experience is that you can't out-supplement an unhealthy environment. No supplement can fully compensate for the ongoing exposure. Once exposure has been reduced or removed, the second step is helping the body recover. This is where my approach differs from some of the more aggressive mold protocols you may see online. I usually don't start with what binder should we use. I usually start asking how can we create the conditions for healing? We start with sleep. What about calming our overreactive nervous system? How do we improve nutrition and support the stable blood sugar? How do we reduce the inflammation? How do we actually support body's natural ability to detoxify? And lastly, can we address the histamine burden if that's what's contributing to the symptoms? Because ultimately, the goal isn't simply to help someone survive mold exposure. is to help them build resilience. Resilient means the body can adapt, recover, and respond more effectively to future stressors, whether those stressors are environmental, physical, emotional, or health related. And that's really the broader philosophy behind everything I do in my practice. So, if recovery isn't about a single supplement or protocol, what does a recovery plan actually look like? Let's walk through the key pillars. um, I focus on helping patients recover. Let's start with sharing a story that I've seen more than once in my practice. A patient comes in struggling with fatigue, brain fog, poor sleep, increasing sensitivity to food and the environment. So, like many patients come through my clinic door, she already had done a lot of work, saw multiple different specialists, doctors, healthcare providers, underwent extensive testing. She was trying very hard to improve her own health, but she really felt stuck. So, just like I mentioned before, I noticed that the symptoms seems to involve multiple body systems at the same time because it was affecting her energy, cognition, sleep, and her immune system was very reactive. So as we explore her history deeply, we started asking questions about her environment and eventually led to the discovery of hidden water damage within the home. Once that environmental issues were addressed, we shifted our focus towards recovery, supporting her sleep, reducing her inflammation, calming the nervous system, and ultimately building the body, helping the body rebuild their resilience. And I have to tell you, the improvement was not immediate. It was not easy. It wasn't a straight line. It had its ups and downs. But over a matter of months, her energy improved, her thinking became clearer, her sleep was more restorative, and she felt more like herself again. And the reason I share the story is not because think mode is always the answer. It's really to illustrate that environmental factors can be overlooked. And when someone asks a different question, it can open the door to a different path towards healing. So let's wrap up. I want to leave you with a few key takeaways. First, mode is not the cause of every symptom. It certainly is not the answer to every health problem, but it could be a contributing factor, and some of that can be missed in many patients. We don't want to blame everything on mold. We want to recognize when mold may be part of a bigger picture. And everyone responds to mold exposure in different ways. Exposure matters, but susceptibility also matters. That's why some people become symptomatic, while others in the same environment may not be. History and symptom patterns are just as important as testing. Listening to your patients is actually the most valuable thing you can make a diagnosis. Testing can provide helpful information, but there is no single test that can give us all the answers. Finally, recovery is about more than simply removing mold or taking supplements. The most successful recoveries usually involve both reducing the exposure and supporting your body and its natural ability to heal with sleep, nutrition, nervous system regulation, and then you build your resilience. Many people spend years trying to chase individual symptoms, the fatigue, brain fog, or health issues. And just keep in mind, all of these symptoms can be interrelated. If you're struggling with persistent symptoms that seem to fit together, um, it is worthwhile to take a broader look at both your health and your environment. Let's help people understand the factors affecting their health and build their resilience and create a foundation for long-term healing. If you'd like to learn more, you're welcome to visit our website and explore some of the resources available there. You can also scan the QR code on the slide to schedule a discovery visit. The discovery consultation is a chance for us to talk, learn about your health concerns, and determine whether this type of root cause, whole body approach is a good fit for you. Whether you choose to work with us or not, I hope today's presentation has given you a useful framework and thinking about mold, recovery, and the role of our environment can play in our health. Thank you for joining me today, and I wish you the very best in your health journey.